Welcome to the Center for Innovation in Campus Mental Health's Conversations Over Coffee video series. My name is Perlin, and I am the Research and Knowledge Exchange Coordinator for the Center. Joining us here today is Nona Robinson and Kate MacIsaac from Trent. Hi Kate, hi Nona.
Hi.
So Nona is the Associate Vice President Students for Trent, and Kate is the Student Crisis Response Coordinator. Today we're going to be talking about developing in-house professional development for student service staff. What Kate and Nona have done today, well not today, but previously, is they have organized a system for professional development on campus using the resources that are available to them in-house. So, let's start. What is the PD strategy at Trent?
Well, it's broad, as you can imagine, but really what Kate and I have both worked on, and Kate primarily, is what we call the Student Support Certificate. And the idea behind that is really to increase the capacity for all faculty and staff, as well as teaching assistants, to be able to recognize when students are having difficulties and to feel confident in knowing what to say and knowing how to respond. We really want to focus on, as much as possible, creating an environment which is highly supportive and empowering for students so that we can work with students early before things escalate. And in the process of which we were looking around at first of all, what it was that people might need more information about, and also looking at our in-house expertise. And I think one of the nice things about working at a college or university is that there are a very large number of people who have a great deal of expertise in a whole bunch of different areas. We all have budget crunches, and so doing things like going to conferences or taking courses or things like that can get very expensive and are often only benefit a very small number of people. But what we found is that when we go around and talk to the folks who work at Trent, who are able to do these different sessions for us, they're actually, in most cases I think, very willing to do so. And they're also able to bring a lot of local expertise around what the resources are and what students' experiences have been. And I think it's worked exceptionally well. And I will say Kate has been the driving force behind this, so she could probably provide a lot more detail about the different folks who are doing it.
Yeah. So can you give an example of some of the local expertise and what it has led to?
Sure. So we have a few different workshops running every semester, and Nona has offered to facilitate a few of them. So she brings her conflict resolution and conflict mediation expertise and shares that with our different members of the Trent community. And she also facilitates a workshop on student development theory, which gives a bit of background on the different developmental theories that inform students' behavior and how that can impact our interactions with students. Other things might be that we look to our Trent International office to facilitate a workshop on supporting international students, or our First People's House of Learning to facilitate what is called the Kairos blanket exercise. And the Kairos blanket exercise gives a history of Indigenous peoples in Canada in about an hour using an interactive method, so using scrolls and blankets to recreate that. Yeah.
So who takes part in the certificate? Is it all staff, or is it just people from certain departments? How does it work?
So the certificate workshops are sent out with the staff development schedule each term. So Human Resources has been very generous with distributing the list of certificates to all of the managers on campus. Yes, it's really helpful. And then people can sign up as they wish and as they can get time to do so during the year. So a lot of people who have participated are frontline staff, so that could be academic department administrators, it could be people working in student affairs, in housing, a lot of teaching assistants, some faculty, so really catches a lot of different folks on campus. And then later in August, actually, we're doing many of the sessions in one day that will be offered to our food services staff.
Okay. And what's the response been generally? Is this, by the way, certificate program mandatory, or is it optional? Do people just sign up because they want to, or is it something that they have to do?
So it's optional. It is optional. I think that some managers might recommend certain workshops to their staff, but it is an optional certificate. So we have lots of people who also will take 1 or 2 workshops and just take as their interest peaks, and others who really want to complete the entire certificate.
Right. So let's talk about the program itself. Like, what led to you developing like a kind of a comprehensive approach to getting this certificate out to people? Like, what goes through your head, and like these are the workshops that people should attend, so on and so forth?
So it really comes back to what Nona was saying about the early identification of students experiencing difficulty of any kind, and enhancing the capacity of our folks on campus to be able to address those concerns and refer people appropriately to the services that are available to them.
So did you do a needs assessment before that, and you're thinking about what people need to learn?
So we did some consultation with the directors within Student Affairs to see what aspects of their department they need the campus community to understand, and what kind of skills that they hope staff and faculty could use to complement their services. And then as we go through the student support certificate, participants provide feedback. They have the opportunity to provide anonymous online feedback after every workshop, so they can continue to help the program evolve and also request different workshops.
And have you had much of that happen? People requesting different kinds of workshops?
Yeah, so sometimes too, when there's a lot of feedback saying this workshop could have been longer, or it would be nice if there were more additional information about this, we've provided a part 2 to certain workshops. Yeah.
So are these workshops very comprehensive, or are they more like introduction to something, and then you direct them elsewhere for more information?
I would say that they're somewhere between an introduction and an intermediate level, just because we are trying to work with everybody's different knowledge and skill set that come into each workshop.
I think one of the things that we're finding is when individuals who aren't working in professional student services, so who aren't counselors or who aren't health services folks or residence folks, have a better understanding of what the resources are and how we approach working with students who are in difficulty, they're also much more comfortable referring students, and they can talk knowledgeably about some of these different services and areas. One of the other things that we find is some folks end up doing this sort of training often in response to having had to deal with a student issue and feeling as though they're not necessarily equipped the way that they would want to be. We had one faculty member who basically said that this was a really important orientation to supporting students, and this was something that he hadn't really had a whole lot of background or training in. And one of the other things I should mention is we've also really focused on areas which are high anxiety for staff and faculty who don't work in student services, who maybe don't have a whole lot of experience in some areas. So one of the very, very popular workshops obviously is Safe Talk for suicide prevention. And I think Kate's trained over 700 people at Trent in the last 4 years. And that includes students and student leaders as well. The idea, again, with that is that it's not that people are going to become experts in suicide prevention or suicide intervention. What they are going to do is feel more confident in being able to have that conversation with the student and being able to get them the help that they need. And we're finding that's working really well because, again, students themselves start to feel more confident, and our staff and faculty feel as though they have a very important role to play in this, which is really valuable.
Sounds like it has very large impacts on your campus as a whole. What would you say are some of, I'm not sure if you have these numbers, but kind of like a before and after you implemented this, what do kind of the statistics look like in terms of like student satisfaction or like say rates of admission to the counseling services, things like that?
It's really difficult to tease out causation on any of those things. I think every college and university has seen really huge increases in the number of students accessing mental health services. And there are probably multiple reasons for this. I think one of the things that I have found is that my interactions with staff and faculty when they are dealing with different sorts of issues, a lot of them are coming with a great deal more confidence, and they know who to get in touch with. And so for me, what that translates to is them feeling more confident talking with a student if they're concerned about them. Trent's always had high student satisfaction rates. It's a nice, small, very personal campus. But the concern for me always is, are we doing what we can to stop things from escalating? So I will joke with student services folks that I really want all of us to be really, really busy in September and October, and less so in March and April, because if we can catch things early, then there's still a fairly strong chance that the student will be able to succeed that academic year. But if it's escalated until March or April, at that point, things may have just completely tanked for them.
Absolutely.
We're still not where we want to be with that, but ideally what we're doing is we're creating that sort of environment where students do seek help early when the problem is still manageable. So,
in the early days of getting this off the ground, were there any challenges that you didn't foresee?
That's a good question. I think the first go around we had rooms that weren't big enough, actually.
Wow.
Yeah. A few of the workshops, there were quite a few people who attended. So as the program has kept going, there have been a bit of a decline in numbers because people have already taken a lot of the core workshops. So in the beginning, it was really finding what the right number is for each workshop and which ones people were interested in and which ones need to evolve, and then the feedback is always very helpful. So if, say, the description of the workshop didn't match up with the learning outcomes, what actually were the outcomes, then we might have to revisit what is published or publicized.
It sounds like people were very enthusiastic from the get-go. I think one of the things that, not say an issue in professional development, but kind of one of the things that have to be dealt with is kind of buy-in from staff. How do you get people invested to want to do these things? But it sounds like you didn't really have that problem.
No, there was buy-in pretty quickly, and I think word of mouth has helped as well. So as we get new employees coming into different departments, they might talk with their colleagues and hear of the program, and often they'll contact me to see what the schedule is for the term.
Our next sort of big goal is to really increase faculty participation, and there's all sorts of reasons for lower faculty participation compared to staff participation, including the fact that many of our faculty are sessional instructors, so they're coming on to teach a particular course on this campus. So we're planning on doing more outreach to departments. We also have a relatively new Center for Teaching and Learning, and so working with them, because one of the options too we might be looking at is tailoring some sessions specifically for faculty to deal with classroom sorts of issues. Because that's, again, where a lot of the faculty interactions with students will happen. We also know that if students are interacting with anyone, it's going to be faculty members. And so, again, the more confident our faculty feel about being able to refer students to resources, the better. But that's exactly the same reason why we're looking at training the food services staff. They're frontline people. They see the students every day. Who is it that the students are coming into contact with, and are those folks people who are going to feel confident in being able to say to a student, "Hey, I notice you're not doing too well recently. Are you okay? Is there anything I can help with?" But again, on the basis that everybody is involved in that sort of student support.
Would you anticipate in the future different departments coming to you and saying, "Hey, we want," I'm talking about faculty, "we want a specialized training for, say, the Faculty of Engineering, and we want a specialized training for the Faculty of Teaching," and do you anticipate that happening in the future?
Probably not engineering, because we don't have engineering.
Oh,
that's okay. It's possible. I think part of the thing is just as you try and go where the students are when you're doing programming, you might want to go where the faculty are. So we could potentially be doing departmental workshops. Ideally, one of the things for me is to try and get a whole range of different people in a room. I did a session last year on dealing with disruptive behavior and supporting marginalized students for faculty specifically, focused on the classroom. And it was really fascinating because I had people from political science and I had people from nursing and people from social work. And it was really interesting, I think, for the faculty members themselves to talk about some of the different things that they had encountered and some different approaches to dealing with it.
And I think one of the things that happens when you get people with different backgrounds in the room is they realize that their individual problems are not that special in that sense, that everyone is dealing with the same things with their students and the kind of issues that are happening on campus. So I think it's really great.
Yeah.
Another thing that we did this past year was in partnership with the Center for Teaching and Learning. We did some more passive programming rather than trying to get people to come to us. We created some postcards with some of the data from the National College Health Assessment Survey and how that might apply to the classroom in different ways. So we had different themes go on throughout the year that were then delivered to the departments for faculty to view on their own time if they wanted, and then provided like a web pointer, so a web page that they could refer to for more resources.
So at this point, what percentage would you say of the staff has actually taken part in workshops? Are they people who just haven't done anything?
Yeah, there are definitely people who haven't engaged at all. So we've had over 280 people take at least one workshop. So that would be staff or faculty.
Contact probably about 800 or 900 staff faculty.
Yeah.
So it's a good percentage.
Yeah. And with these people that haven't really engaged yet, how do you plan to maybe address that or encourage them to engage? Yeah.
So for some different departments, it can be a bit of a challenge because they might be on campus at different times. So one way that we worked with that was with the Director of Food Services was providing one day for the staff there to be able to complete some of the workshops. So for some of our staff who might not be here during regular hours, it can be more difficult. So one request has always been to have things online. So that might be something to look to, but I do really think that there's a benefit to the in-person training, to learning from one another's experiences, and like you said, knowing you're not alone in that issue.
Absolutely. Yeah. So because Trent is on the smaller side, what do you think are some of the differences between, say, you guys and U of T, for example, in terms of offering professional development for your staff?
Well, I worked at University of Toronto for 12 years.
Okay, well, you can certainly speak to that.
In fact, the germ of this idea was a program that a number of us worked on at University of Toronto, which unfortunately I don't think is running anymore, which was around enhancing the student experience. And it was the same sort of concept, which is you've got these different people in-house who would be able to develop workshops and sessions, and that was done through what was then staff development, and it's a new title now, I forget what it is. I think one of the things, there's several things that if people are looking at setting something like this up that I think are really important. One is to keep it as simple as possible. So we are basically using pre-existing online registration systems, and Kate's got it all set up, and so people can just sign. It's the dates are listed on the website. People and emailed out by Human Resources. People just sign up. They're told when to come. We take attendance. Kate's managed to set it up so that it's actually relatively trouble-free, I think, to organize for the most part.
As long as people sign the attendance sheet. Yes,
yes. So speaking as a presenter, it's like, don't forget your attendance sheet. But yeah, we've tried not to formalize it too much. We want it to be something that people feel is accessible. We want the presenters to feel this is something that they want to do on a regular basis. Some presenters will be presenting once a year, some will be presenting once a semester, what we're finding is it actually works quite seamlessly. I think if you try and make it really complicated, then it's not going to be as effective. I think part of the thing too for the buy-in is we really have a very strong culture of student support at Trent. But I would argue that every university and college has that. You've always got people who are deeply passionate about supporting students. I think sometimes in a larger university, people can get very specialized. So, rather than having people who are generalists who are able to deal with a whole range of different issues, you have someone whose main focus is, for example, learning disabilities or something like that. I think being able to sort of let go a little bit of the idea that it always has to go to one specific person, being able to say, you know, everybody on the campus is invested in this, is a really powerful message. So that's another useful thing, is if it's coming from someone like the AVP students or the provost or even the president saying this is a really important thing to do and this is something that we really care about, I think that can be really useful as well.
Yeah.
And I think both Kate and I are always happy to chat with people about how they might set it up on their campuses if they're interested.
Have people asked you yet?
Yes.
Yeah,
Yes.
yeah. I've had a bit of contact with folks at other colleges and universities about how the program started, kind of where to begin, what some of the learning outcomes are and that kind of thing, and I'm happy to share information.
That's really great.
Yeah.
Do you intend to spread this as far and wide as possible? Because it sounds like it's a great initiative on campuses. It helps the students, it helps the staff. So
I think on our campus, spread it as widely as possible, yes, but it's difficult to do that because every campus has its own culture and has its own ways of doing things and different department titles and all of that kind of stuff. So I think tailoring it to each institution is really important. Even when we facilitate these workshops for the Durham campus, so Trent has a campus in Durham, the workshops are a little bit different. They need to be different because the setting and the culture there is different.
And the referrals are obviously going to be different as well.
Right.
But I think having it in-house makes really helps reinforce the familiarity that people have with the folks who are working in their own student services and their own support systems. I think, you know, our instinct might be, well, we need to bring in a guest speaker to do training, or we need to send people to a conference or training workshop for professional development. But when you have, for example, someone who's a really great presenter from Student Accessibility Services talking about supporting students with disabilities and talking about what accommodation looks like and talking about what universal design looks like and all of those sorts of things, they're able to talk from the perspective of someone who works within that local environment. And I think that's tremendously valuable. I think it brings a lot of credibility, and it also produces the side effect, which we've been finding. We get a lot of feedback about this, where people start to build those relationships with the presenters. But another interesting little thing is that we keep getting feedback saying from folks saying, this is really great. I never see these other staff members, or I never interact with people from that department or anything like that. And so just being having to sort of build that sense that we're all working on this together. And it's a nice opportunity for people to go and get some professional development, which is fairly easy for them to do. And even, we also worry about frontline staff members, because if you're sitting at a desk or you're taking appointments, it's difficult sometimes for you to carve out 2 days to go to a conference. But it's much easier to carve out 2 hours to go to a workshop.
It's very efficient in a way, because not only are you're getting everyone together, building those relationships, but I think oftentimes at institutions, particularly large institutions, there's so much going on. There are experts everywhere on your campus, but nobody really knows where these experts are. So what you're doing is also bringing people together, that if someone needs information on PTSD or eating disorders, they know who to pass the baton to in some ways. It increases the capacity of the community as a whole as well.
Yeah. Well, and I worry sometimes because we have these wonderful experts, and but the demand is so high always. So if you're working with students one-on-one, it's really great and really important for those students. But sometimes it's difficult for our professional staff to know in advance when a student's making an appointment. Is this going to be something that is a really, really intense issue that is going to require a lot of work? Or is this something that I can actually talk to the student about for 5 minutes and work on something with them, and then they're done and they're ready? So part of it for me too is ensuring that the professional staff are working on the really serious issues with students. And as much as possible, the student don't have to bounce from office to office, which even on a small campus sometimes will happen. If we're not sure what the student needs, and if we haven't had that conversation with the student about what they're struggling with, that we might sort of say, okay, well, you should go to financial aid, and they're like, oh, well, you should go to counseling. And hypothetically, they could go to 3 or 4 different offices, and often almost always, in fact, many of our students are dealing with multiple issues.
Mhm.
And so they may actually need to talk to a bunch of different people. But if they can talk to someone who can really help them with a number of those different things, especially if they're not necessarily high level,
Mhm.
and that way when they do that referral to an office, they're dealing with the stuff that requires that sort of professional expertise.
Mhm.
That can make a huge difference. And it also means that our professional staff are able to focus on those high-needs students.
Mhm. And of course, if you're reducing the number of people that a student has to see in order to get their needs met, you're reducing kind of the attrition as well, because the more difficult you make it for
Yeah.
someone to get help,
Yeah.
the more unlikely it is that they're actually going to get help.
And when a student is dealing with a lot of these different issues, and you know, Kate deals with students who are, in many cases, have multiple very, very complicated, complex things, you know, the idea of also trying to figure out who's the right person to talk to can just be an extra burden.
Yeah.
So that's the other half of Kate's job, is
Mhm.
helping students to navigate all the different systems.
Mhm. Yeah. And you know, it sounds like you're both very, very proud of this, and I congratulate on you on this, because it sounds like it has just increased the capacity of your campus as a whole. It's increased the capacity of staff, and the students as well. They're getting better treatment in a way. They know who to go to and then who to get help from. It's really great. Any final thoughts?
Oh, I don't think so.
Okay. Well, thank you so much for joining us today. If you'd like to see more of this, please go to campusmentalhealth.ca and sign up for our newsletter. And if you're interested in more news, ideas in post-secondary education's mental health, well, go to our website, because all of that and more is available there.